Ladies and gentlemen, let me just say that we just finished a meeting of our task force, and we've got these incredible people, these incredible men and women from across the ministries in the Government of Ontario. The Minister of Health and Solicitor General, of course, are part of that task force, and it reports to them and then to the Premier. But we've also got these incredible Canadians from right around this province, businessmen and women, medical professionals, people who are engaged and involved and want to help Ontario get through this pandemic, get out of the abyss that we are in, and get the lives for the people who live here back to something resembling normal. We ask them for their counsel and advice. We ask them to shape our operational plans for rolling out the COVID-19 vaccine. And in fact, they spent this last hour working with us in this, our third meeting, to do exactly that. And they have been shaping our plans to help us meet our mission of delivering an efficient and equitable vaccination rollout program for the people of Ontario, in that order that every single eligible person can voluntarily receive that vaccine and have sufficient information to make the intelligent decision to go and do so. It was an incredibly good meeting. The task force people and the advisors in it are on side, and we are all excited because after all these months of that terrible pandemic, we are now moving towards really what could be the most incredible thing for the province, the start of vaccinations against COVID-19. The first vaccines arrive in Ontario on Monday and flow out to 2 sites, one here in Toronto and one in Ottawa, and vaccinations will start right after that. So I'll take any questions that you might have from there, but let me just say the vaccination program is one of the most incredible ways and means to help us get back to normal, to help us defeat the pandemic, to help us win the war against COVID-19. But while we're rolling out that vaccination program, and it is going to take a while, we will get the vaccines on a schedule that is not perfect. They will arrive over a long period of time. We cannot vaccinate every single person on day one, so people do have to be patient. The prioritization has been very clear from the Government of Ontario. We are going to come at the people who are in most vulnerable circumstances and our healthcare workers first and get them vaccinated because the tragedy has been visited upon them most. And then we will work through the rest of the people in this province and the priorities that the government will help us define based on our recommendations back to them. And we will do it, but it is going to be slow. There will be bumps in the road, so please be patient. And in the meantime, while we're rolling out the vaccination program, don't forget the health measures that are absolutely crucial to making this a success. Wear your mask. Don't touch your face. Wash your hands. Stay away from people. Stay away from me. And stay home if you possibly can. I'd be delighted to take any questions.
General, I've received several emails from many different news sources. The number one question everyone has is how many doses are we going to get and who's going to get them first?
So let me just talk about the rollout of the vaccination program here in Ontario in December. On Monday, we are going to receive 6,000 doses of the Pfizer vaccine, which I think everybody knows was approved by Health Canada yesterday. And that should give us incredible comfort. The rigorous accreditation program, the incredible testing that Health Canada puts a vaccine through before they approve it, gives us confidence that this vaccine is going to work and that this vaccine is safe for all of us to take. On Monday, we'll receive 6,000 doses, 3,000 here in Toronto, 3,000 in Ottawa, and on Tuesday, it is vaccination day, and we will start vaccinating people in accordance with the priorities that the Government of Ontario has set. Those priorities are those in the most vulnerable circumstances and our healthcare workers. And those in the most vulnerable circumstances, given that we only have a few doses so far, we want to use data to select which ones we vaccinate first. So we are looking at the staff that work in the long-term care homes inside of the red zones, the lockdown zones, the hot zones, those staff inside of long-term care homes that have already had COVID-19 visited upon them in such a tragic manner, and those staff in the homes that have communal living, where people heat together in the kitchen and where there's more than one resident in a room. That's where we want to go first and have them come to the special vaccination sites at the University Health Network Hospital here in Toronto and Ottawa Hospital in Ottawa itself. We cannot move the Pfizer vaccine from where we receive it at those 2 sites, so we have to have people who can come to the special vaccination site. And then at the same time, we will also do some of the healthcare workers in those locales just to make sure that we are using all of the vaccine in the most efficient manner possible. For the rest of December, we believe that we will receive 90,000 doses of the Pfizer vaccine. And we'll roll them out to 13 centers, 13 hospitals, which will become vaccination sites across Ontario. And we will continue to work at those same two priorities, those in the most vulnerable of circumstances and our healthcare workers. And we will use the same data-driven method of making decisions to do that correctly. We'll go after those long-term care homes and retirement homes and the people who work there specifically because they are the ones who need it most, and we'll go after the healthcare workers. And then in December, we also expect to get anywhere from 35,000 to 85,000 doses of Moderna, presupposing that Health Canada in the next days or weeks accredits it for use in Canada also.
This is a real quick question. Does 6,000 doses translate into 3,000 workers, or does 6,000 doses, is 6,000 workers both getting two vaccines? So
we're taking two approaches, and the first approach is we're going to trust and verify. We're going to take 6,000 doses. Each person has to have two. We will, in Ontario, end up vaccinating from those doses 3,000 people, and we will keep in the deep freeze the second dose for their vaccination some 21 days later. Depending upon our confidence in the supply, how it rolls to us, we may change that decision later down the road, but right now we will vaccinate half and keep the dose in the deep freeze so that it's ready for them on day 21.
Perfect. This question comes from Laura Stone. Laura Stone is asking, why is Ottawa one of the first sites in the province to, why is it being prioritized as opposed to a lockdown?
Ottawa was selected some weeks ago as one of the first two sites, and what the rationale was that it was good to test the logistics chain outside of just Toronto itself, and so fly something into Pearson and have to distribute it, and then have to distribute it as far afield as Ottawa. Ottawa has gone through some tough times and recently came out of more stringent conditions. They have had some long-term care homes and retirement residents that have had COVID-19 visited upon them in tragic circumstances. So all those things were used to make a decision to use Ottawa as one of the first two test cases.
The next one is from Rob Ferguson, Toronto Star, also the Vice President of the Press Gallery. How are the shots going to be coordinated, or how is the vaccines going to be coordinated? Do the workers show up at the nursing homes or where the location and form a line and get it, or will they be invited? How do they know who's going to get it, and how are they going to get it?
The vaccinations are going to be rolled out in a coordinated fashion. So the teams now are working with the long-term care homes whose healthcare workers, whose workers will be getting vaccinated first, and they will be given a period of time and an appointment to come for the vaccination based on the fact that they are working in those homes, and then will receive it. It won't be simply come as you are and then line up. It'll be a window that you will have to come and get your vaccination, and you will know when that window is for you personally.
Are those locations being kept secret?
The locations of what?
The inoculations or the vaccine?
No, the two vaccination sites are going to be the University Health Network here in Toronto and Ottawa Hospital in Ottawa.
Okay, that was one of the questions. And this comes from Amanda, CBC News in Ottawa. How many vaccines are coming to Ottawa? I know you expect
on Monday, 3,000 vaccines will arrive in Ottawa, presupposing everything works with flights and supply chains the way we want it to and expect it to, and have been told that it will work. 3,000 vaccines will arrive in Ottawa on Monday, the 14th of December.
Last question. Yep, last question. And you can tell us more about the challenges of getting the vaccine out into the long-term facilities or any location. It's sensitive to vibration and temperature, and what are the parameters that will limit?
Well, right now it's straightforward for us. We are not going to move the Pfizer vaccine from where we receive it, so up to 23 sites in the not distant future here in Ontario will be receiving the Pfizer vaccine and will become special vaccination sites, and people will come to it in those first priorities. If Pfizer changes the characteristics and the parameters about the vaccine and allows us to move it, then we would obviously go into the long-term care homes. But we believe that the Moderna vaccine is not going to be far behind the Pfizer approvals, and we have been led to believe that we should see Moderna vaccines available to us in Ontario before the end of December. That vaccine has different characteristics and is easier to handle from many perspectives and will allow us to establish special vaccination sites in the long-term care homes to actually start to vaccinate the residents in those homes that are in the most vulnerable of circumstances.
And we see Peel's numbers are off, they're number one in just about every metric in the charts. Why isn't the vaccine going to Peel?
Because we only have 3,000 vaccines coming into the Toronto area, only have 3,000 coming into the Ottawa area. We can't do everybody, no matter how urgent the need is with that limited number of vaccines. We still won't be able to do all of that by the end of December, but those are the priorities, and as the vaccines come in, we're going to have the teams ready to start the vaccination clinics, starting with those crucial areas and get people vaccinated and start to defeat COVID-19.
Fantastic. Thank you very much, gentlemen.
Thank you. Thank you, folks.